ProPublica, yet again, exposed the fraud that is our healthcare system. A doctor went to his own employer for a COVID-19 antibody test. It cost $10,984. Physicians Premier ER charged Dr. Zachary Sussman's insurance $10,984 for his COVID-19 antibody test, even though Sussman worked for the chain and knows the testing materials only cost about $8. $8. Even more surprising, the insurer paid in full. I had this quote recently when talking about a similar issue. The U.S. healthcare system is a scam on top of a scam within a scam. Like, there's multiple levels and degrees of scamming going on. You got big pharma scamming people. You got the for-profit health insurance companies scamming people. You got the actual providers scamming people. There's just scams all over the place. The whole thing is a scam. It's an absolute mess. So ProPublica recently reported that there are these $175 COVID-19 tests, right? And a place in Texas, an ER in Texas, would charge $2,479 for it. $175, but they charge $2,479 for it. Now we know, basically an $8 antibody test charged $10,984 for it, and the insurance company paid, which means what? Premiums. Up, because you're all getting price gouged. We're all getting price gouged. Honestly, the system's a joke. It's a total joke. I've never seen anything this ridiculous, this over the top, this brazen, this in your face, because they know they can get away with it. There's no, guys, it's the wild, wild west. There's a total lack of regulation. Listen, when you look at how it works in the UK. Now, according to some studies, the UK is the best healthcare system in the world. And they are fully nationalized. Like, it is a single payer system. It is public funding of public institutions, public hospitals, and their public doctors. Everything's totally socialized, nationalized. So when you look at the way they do it, it's all the care is free. Not only do you not have to pay anything out of pocket, but when you leave the hospital, they offer you money to take like a cab home. So you can, it's net profitable to go to the hospital. Imagine that. But when you go to get like, you know, pharmaceuticals, for example, you need medicine. You go to the pharmacy. It only costs like 10 or 20 bucks for everything. That's it. So it's just go there, 10 or 20 bucks, whatever the medicine is, you get it. That's it. And yes, the government is involved in every aspect of this industry because it's viewed as an industry where the profit motive perhaps doesn't really belong. In the same way that, like when you look at police officers, it's a public service. It's a public good. You shouldn't have the profit motive for policing because then what's going to happen? Okay, the rich people are going to buy, you know, police to help them, but then the law is not equal across the board and justice isn't blind and you have like mercenary police forces fighting each other. It's the same thing with prisons. If you have private prisons, you know, you're setting up a poor incentive structure. And that's why you get things like 3 strikes laws, for example. You have private prison lobbyists lobbying the government to make more things illegal so they can put more butts in more beds to make more money. There are certain things where the profit motive doesn't make sense at all. It just shouldn't belong there. It makes things worse with certain things. You know, you don't want a for-profit infrastructure. You don't want for-profit police. You don't want for-profit fire departments or military. That would literally be mercenary armies if it's for-profit militaries. You know, guns for hire. Does that sound like something a civilized society should have? Of course not. Everybody understands this with certain things, certain industries. But for some reason, we've just grandfathered in the craziest of them all in the United States, healthcare. This story rattled this guy so much, rattled Dr. Zachary Sussman so much, he stepped down. He's like, I can't be, this is absurd. This is all a scam. This is fraudulent. I'm stepping down. I can't be a part of this. I can't be a part of this chain. Because he realizes that it's a scam on top of a scam within a scam. And we all just casually go along. Premiums get jacked up more and more every year. Fewer things covered. You know, even the fact that they try to say you have plans. Like, which plan would you like to pick? What does that mean? What plan would I like to? It's health insurance. If I get sick, I'd like to get help. That's what I want. Can I get that plan? Well, no, see, this one only covers certain things, and this one only covers other things, and this one's a lower cost, but it only is catastrophic coverage, so you have to basically be on the verge of death in order for anything to kick in to actually help you. And I love the idea, premiums. Like, okay, I'm going to pay you every month. I'll pay you $400 every single month. And then when something happens, they turn around and go, oh, you have to pay the first $2,500. I've been paying you $400 every month for years. And then something happens and you say, that's great, we got it, but you get the first $2,500. Why have I been paying you $400 a month for years? Why have I been doing that? That makes no sense. How many ways are you going to rip me off? Premiums, co-payments, deductibles. It's a black hole. I can't. This is an instance of, it's not even the insurance company that's ripping them off. It's either the makers of the test or the sellers of the test or the healthcare providers. I think it was the healthcare provider, which is why Zachary Sussman was like, I got to resign, because that's the company he works for. He's like, oh. And they even billed for, like, the $10,000 includes also the nasal swab test, which is the current COVID test. Like, do you have COVID now? He went for the antibody test, got the antibody test, but they also charged him for the antibody test plus the regular COVID test. He didn't even get the regular COVID test. It's just, they're just shaking people down, bro. They're just shaking people down. And people wonder, why is it we have this exorbitant healthcare cost in this country? Well, here's one of the reasons right here. Everybody's price gouging everybody. I mean, we've gone over the hospital charges. I remember covering a story on this show years ago, going over the hospital charges where somebody got this insanely expensive bill. And you go through the line, because you could ask for the line-by-line charges. There's one, I remember it was one line that said like cough suppressant aid, and they charged like a few $100 or something. You know what they were talking about? Tissues. Cough suppression aid, hundreds of dollars they charged them. The person had used a few tissues while they were in the hospital. Charged a couple $100. Anybody who defends the system is a sucker. Or they're corrupt and they're in on the game. So when people say, oh, we have the best healthcare in the world, my ass cheeks, son. The best healthcare in the world, please. How much evidence do you need? Do we care about studies or do we not care about studies? Do we care about evidence and data or do we not care about evidence and data? How many times do I have to tell you? The Commonwealth Fund study, which they do, I think every couple of years, 2 or 3 years, something like that, we came in 11th out of 11. Of all the developed countries, we were dead last. There is no argument that we have the best healthcare in the world. Maybe for the wealthiest of the wealthy, the top 0.001% get the best care, but everybody else gets screwed. Regular people get screwed. And you could even, the World Health Organization study, now that's old at this point, 20 years old now, so it's not even worth bringing up. But yes, we ranked number 37 back then. But even the Commonwealth Fund studies from today have us doing abysmally. So this stuff has got to stop, man. It's got to stop. We have to do a single-payer Medicare for all system. We got to... you guys know this. I've said this before. And I'm not even... I literally consider myself a social democrat. Like, I'm not that far left. Internationally, I'm very moderate. But if there were ever industries to nationalize... I mean, pharmaceuticals for sure, too. Like, big pharma, that should be all government. Because we already do a lot of the research and development anyway, and then these for-profit companies come in and swoop up the rights to the drugs that we made with our tax money, and then they make profit off of it. Pharma should be nationalized. Health insurance should be nationalized. We should have a single-payer system. Listen, the more time goes by, the more I lean in favor of the UK system, which is like fully nationalized. And the more I'm becoming... more and more turned off to any aspect of having private, a private angle in our health insurance. Because I think that stuff like this happens. When you have private providers, how do we know that they're, if what's going on is not controlled and not monitored and not regulated, how do we know they're not doing stuff like this? How do we know? They are. They are going to do stuff like this. So, and again, this is not to say that, the private market doesn't work with anything. In fact, I think the evidence shows that there are many ways in which a private market functions better for certain industries. I think that's what the evidence shows. But this is not one of them. This is not one of them at all. And I bet we're going to keep seeing stories like this, man. I bet we're going to keep seeing stories like this. Because I bet there's all this scamming and price gouging and nonsense going on when it comes to COVID.